What's up, guys? This is Caesar again with Nursing School Made Easy. Today's topic is calcium, hypercalcemia and hypocalcemia. I'm going to focus on hypercalcemia first, but before we do that, let's talk about what calcium does, some of its functions, and how calcium is controlled, that we can better understand the pathophysiology behind hyper and hypocalcemia. So again, let's talk about calcium. Now remember that 30% is absorbed through the GI tract. Anytime you eat or drink milk, cheese, anything containing calcium, again about 30% of that is going to be absorbed through the GI tract. Now most importantly, remember that 99% of calcium is concentrated in the skeletal system, in bone. Okay, again, 99% is stored in bone. This is very important. Make sure you know that. Functions. Number 1, transmission of nerve impulses. Number 2, myocardial. That is heart contractions. Okay. 3, blood clotting. 4, formation of teeth and bone. 5, muscle contractions. So the biggest things that we're going to focus on are, again, nerve impulses, myocardial contractility, bone, and muscle contractions. Now, a little side note here. Again, bone is important because if you have somebody like a geriatric patient, a geriatric female patient, that patient may suffer from something called osteoporosis. Again, that's due to bone getting weaker, losing calcium. Okay. Now, what is calcium controlled by? Number 1, parathyroid hormone. Now what PTH does, again, parathyroid hormone, what it does is it increases bone resorption, meaning, let's draw I'm not a very good artist, but let's say that this is a bone here, okay? Inside you have calcium stored. Now, when your body senses that you have low calcium in your body, parathyroid hormone will be secreted and it will cause calcium to come out of bone. Now if this continues, you'll have calcium loss, bone will be weakened, and you will end up with something like osteoporosis, which is why you tell patients, geriatric patients, especially geriatric women, to consume calcium to help prevent this. But again, let's focus on what calcium is controlled by. And again, we're talking about parathyroid hormone. And just to summarize again, parathyroid hormone increases bone resorption, that is calcium out of the bone, getting calcium out of the bone, increases GI absorption and renal tubule absorption. So the overall goal is to get more calcium circulating throughout your body, increasing serum calcium. Number 2, calcitonin. Now this has the opposite effect of parathyroid hormone. So what calcitonin does is it stimulates or promotes calcium deposition into bone. So it's going to have the opposite effect. This would be an example of maybe somebody who is having a lot of calcium in their serum. Calcitonin is going to be secreted by the thyroid gland, and calcium that is outside of the bone or in serum is going to be put into bone. Okay, so know the difference. One is going to cause bone to come out of the, one of them is going to cause calcium to come out of the bone, and one of them is going to cause calcium to be stored into bone. Now, what calcitonin also does is it causes the kidneys to get rid of or excrete calcium. Last but not least, we have 3, vitamin D. And vitamin D is also going to help put calcium into bone. It's going to increase calcium reabsorption. So a lot of patients that are taking calcium, they will also be given vitamin 3, and again, that is to increase calcium reabsorption. Now, let's focus on hypercalcemia. What are some causes? Number 1, we just talked about how the parathyroid hormone causes calcium to move outside of the bone into the serum. Well, one cause could be hyperparathyroidism. Two, malignancies. Some type of cancer, whether it is breast CA, lung CA, or multiple myeloma. Number 3, vitamin D overdose, or taking way too much vitamin D. 4, thiazide diuretics. Now, a little side note here. This is going to come into importance here in just a little bit. Little side note, remember that excess calcium leads to reduced excitability of muscles and nerves. Again, calcium excess leads to decreased or reduced excitability of muscles and nerves. So what are going to be affected are muscles and nerves. Okay, make sure you understand that concept, decreased excitability of muscles and nerves. So let's focus on some signs and symptoms that your patient may go through. Number 1, weakness. 2, depressed reflexes. 3, decreased memory. 4, confusion. Now, let's move on. 5, stupor and coma. Now, all of these here are related to muscles or nerves in some way, shape, or form. And we just talked about how, again, calcium leads to reduced excitability or decreased excitability of muscles and nerves. Therefore, if you have that decreased excitation, again, of your nerves, you are, of course, going to have some problems with your memory and have some problems with confusion if you're having problems with memory. Again, if you have decreased excitation of nerves, you'll have depressed reflexes. You're not moving like you should. You'll also have some weakness. Okay? Along with this impaired memory, confusion, you also have AMS, altered mental status, personality changes. Okay? So make sure that, again, you understand this concept here of decreased excitability of muscles and nerves, and that will explain a lot of your signs and symptoms. Now, those are not all these signs and symptoms. You were on 5, so let's jump to 6 here. Polyuria, leading to dehydration. Nausea and vomiting. Now, why would you have this polyuria, dehydration? Well, depending on what the cause is of this hypercalcemia, will determine this polyuria and dehydration. Remember, if you're having too much calcium in your body, your kidneys at some point, if they are functioning, will try to kick some out. They will try to excrete calcium to bring calcium down. Now again, if this is, for example, a patient that is suffering from some type of malignancy, well, the kidneys are going to try to kick in and get rid of some of that calcium. When you get rid of this calcium, let's just draw a quick kidney here. This would be aorta. This would be kidney here. Have the ureter. This would be another kidney over here on this side. Bladder. A couple of things happen. Again, your kidney is going to say there's way too much calcium in our system, so let's dump it. Along with this calcium, this solute, water is going to follow that. And you will also end up getting rid of H2O or water. Therefore, your bladder is going to get bigger because you're losing a lot of water, and you'll end up urethra. You'll end up voiding that. So you're going to be peeing a lot. If you're getting rid of a lot of water, you're going to become dehydrated if you do not replenish that H2O. Now that is another concept here. If we see here, look, I just mentioned that how calcium is going to come into your kidneys because, again, your kidneys are trying to get that calcium out. So what can happen is you can actually start getting calcium clusters inside your kidney, or renal or kidney stones. So that would be number 8, kidney stones. Now, if they are suffering from kidney stones, they will have flank pain. But that's a different story. Okay, so please understand the concept again. Last but not least, nausea, vomiting. But again, understand the pathology behind calcium. Now, some interventions. What would you do for this patient? As always, I keep on mentioning, make sure you know your interventions. What would you do? Because that is a lot of what the NCLEX will do. It'll ask you about what would you do for this client. It's very, very important for you to understand the physiology or the pathophysiology, but more importantly, what would you do for this patient? Number 1, again, we're talking about hypercalcemia here. you would give loop diuretics. Something, for example, like Lasix, furosemide. Now, in the NCLEX, you will most likely be given both names. Okay, Lasix, also again furosemide. Make sure you know one, if not both. Now, what Lasix will do, or furosemide, what it will do is it'll promote or increase calcium excretion. Now, again, this is a diuretic, so it's going to cause you to increase the amount that you void, increase the amount that you pee. This is a very important concept, so remember this. Number 2, you will administer isotonic saline solutions. Now, we just talked about very briefly about how you'll end up getting rid of a lot of H2O, a lot of water, especially if you're giving Lasix. Well, you do not want to cause dehydration. You want to prevent that. You're giving Lasix in an attempt to void, or get rid of calcium. As a result, you must replenish that water that is being lost, that fluid that is being lost, which is why you give isotonic saline solutions to prevent dehydration. The other thing that you would do if you are not giving the isotonic saline solution is you might want to tell your client to drink up to 3 to 4 liters of fluid daily. Again, this is to prevent dehydration. The other thing you may do is you may administer synthetic calcitonin. Number 5. Now, if this is, again, you're going to have to understand why the pathology is occurring, why the hypercalcemia is occurring. If the calcemia, the hypercalcemia is occurring due to some type of malignancy, well, the preferred medication for that scenario would be something like Beredia. Now, this is for hypercalcemia caused by a malignancy. The other thing you may tell your patient is to change their diet. Okay, especially if it's something due to like vitamin D overdose. Well, you would want to hold vitamin D. Now, again, the best way to retain this information is just to repeat and see how much you retain. Again, if you have any questions, suggestions as to how to make the video a little bit better, please write down below your comments. Thank you for watching.